Without a doubt, this is the most noble of all philanthropic efforts. We're talking about human beings. We're talking about our children. In some cases, we're talking about our grandchildren. This environment is far more challenging than any generation before them. These kids are having difficulty. They're in trouble. We need to respond, because if we don't, the consequences are unacceptable. I would say that Youth Opportunity Foundation exists to complement the work that is being currently done in the behavioral and mental health treatment areas. These programs can only do so much with the children that they have. Either the children age out of the program, or they complete the program and then they're released. But if you don't change the world that they are re-entering, if we don't give them options, then they're right back in the same environment, they're right back in the same neighborhoods, they're doing the same things that got them into the issue to begin with. So what the foundation exists to do is to pull together programs to look at not just the effects that landed them in programs, but the causes of the situation. So we're going to attack causes.
It's taken me a decade to try to understand how our system got to where it is today. Often youth are treated not based upon whether it's a detention or whether it's a residential or a treatment type facility, based upon who's going to pay for it. Oftentimes the youth receives the treatment based solely on, is the federal government helping pay for it? Do they have insurance? Is it welfare? Is it whatever the source is? And that's not fair to the youth. I've mentioned before, the right child in the right place for the right reasons. A vast majority of them should not be considered juvenile justice. They need treatment. They don't need to be warehoused.
Our initial funding platform is built on 4 pillars. The 4 pillars include post-secondary education. We're looking at 2 potential options there. One is coursework. The other is vocational training. We have partnered with Ivy Tech Community College to provide online programming. The second platform is jobs, a means of making money to support themselves. The third is applied research. We want to help programs improve clinical treatment, thus we get better outcomes. The fourth pillar is advocacy. We want to establish a mentoring relationship with a trusted adult that will be there when these kids have the need to help them make a decision. The question is, again, what are we returning the children to? What's the environment? What exists for them? Where are their options? That's where we need to direct our focus. That's what donors should be looking for, is where does my dollar make the greatest difference? We think it's with kids because they're in dire need of a change. And 85% of them will tell you, I want to change my life. I want to change the outcome. I want options in my life. They're looking for those types of situations. That's where we can make a tremendous difference.